we were also studying gynecology, which is an essential subject in the final year of MBBS. In the gynecology, we used to perform we used to observe and then used to conduct actual normal deliveries, as well as we used to see C-sections, and then taking histories from the gynecology ward and knowing their different things about that, what happens in diabetic mother who is pregnant, hypertensive mother, they are at how much risk of giving birth to a normal baby and normal fetus. Similarly, we used to look at the cases like if I recall from PEDS. Pediatrics is another subject, and in a short form we call it PEDS. We have Dr. Fuzia, who was very great mentor of us. In the medicine, we used to rotate all 4 wards. In the surgery, we also used to rotate all 4 wards. Then in the gynae, we had 3 different wards. In the PEDS, we have 2 different wards. I also did my house job in the PEDS. Dr. Fuzia, she is a very hardworking and passionate lady who was our head of department, and we had very great PGRs over time. I can still recall their faces and names, and they taught us very well. Where pediatrics is a very vast field, we used to rotate in neuro bay, JR bay. There was a dialysis department in the PEDS, NICU PICU. NICU PICU is the neonatal ICU and pediatric ICU. Even I worked during my house job in the NICU PICU of Lister. So this all was a very great experience, rotating and studying in the final year with the great professors. My life was very easier from the 4th year, and I started enjoying my study in actual. But my focus was in improving the life of the patient. So from my 4th year to final year of graduation, I started doing some volunteer work, and one of my achievements was building the basis of Breast Cancer Foundation. Even indulging myself in the busiest study routine and handling my hostel life alone. I will make a video on my hostel life as well, but this is all about my graduation years. I will also like to tell you more about my house job. Although I was looking for, I was very passionate to do USMLE and to go to USA to do my medicine residency from there, because I felt during my graduation and during my house job that medicine required a high level of achievements and commitments as well as knowledge. So I started studying for USMLE exam, but with the house job it was very, very hard to maintain my study, because sometimes there are 12 hours and 24 hours duties, sometimes there are 36 hours duties, especially in the medicine they were very busy duties. I completed my rotation, the medicine, surgery. Then I was very curious about what happens when there is head trauma, and how the physicians and neurosurgeons deal the cases of head trauma like subdural, epidural hematoma, and how do they perform spinal surgeries, and how do they perform their head trauma surgeries, and how do they operate the brain tumors and like that. So I did my neurosurgery rotation for the same reason. Then in the pediatrics, I was very curious, because if we come to the pediatrics, we have to keep a different knowledge about PEDS cases. They are a little bit different than the adult cases, as well as the doses of the pediatric children as well as neonates are different. The management is different. So I was very curious to do my PEDS, so I started working in the PEDS as well. Third, if I talk about medicine and surgery that were essential. General medicine, I worked in the ward 12 of Lister under supervision of Dr. Zafar Ali Khan. In the neurosurgery, we have our great professor Dr. Ahmed Saab. In the PEDS, there were Dr. Fazia, and in the surgical ward, we have our great professors. So in surgery, we have our professor Dr. Khalid Hussain Qureshi Saab. So all those mentors were very great. They taught us great on the patients, as well as I rotated in the free time in the cardiology, where I learned under one of our great professors. Then I rotated in the neurology. I also learned from Dr. Fahad. I also learned from Dr. Fahad, who was the head of department of neurology. Later, I also rotated in different other departments in the free time to have enough knowledge. I was too much busy during my house job that I barely find time to study. Although I had the options to choose lighter rotations like pathology lab and others. Very interesting. In pathology, you learned a lot. But I had a great experience during my study time. I gave my full commitment to pathology during my study years. I watched the microscope each and every picture. We used to draw histology of each and every biopsy. So I was more focused on the clinical things. My whole year of internship it passed very soon for me because I was too much indulged in the patients. I didn't have time to attend my family calls. I was especially to cure the patient, to know their histories, to indulge actually into their problems and to treat them, to give them in a proper ear, to listen them, then answer them properly. So all this I was trying since my earlier years of graduation as well as during my internship. I started building my skills. Later, I planned to study for my USMLE. Then again, because I am a person who go into the things very deeply, so I started to studying Kaplan books. That took almost 6 months for me because I was listening lectures as well as I was doing, because some of my colleagues who have done with USMLE, they told me to study from Kaplan in the mid of the 2018. So I gave 2-3 weeks to my family because it was a 6-year long journey in the Nashta where I was away from my family, where I learned not only from my college life but as well as the experience of hostel life is different. After getting 2 to 3 weeks to my family, I started studying for the plan, and until it was end of 2018, and I was still blank how to prepare for the USMLE step 1. Later, what I did, I started doing. I asked from some colleague, they advised me to buy UWorld, and they said that 6 months is enough. Just do the questions quickly. And when I started USMLE step 1 UWorld QBank, it was so awesomely written. There were a lot of knowledge in that, and I'm a person who used to even read out of the course books during my prof sessions, during my graduation. So I started indulging into each question just like a researcher. It took a lot of time to me, and when it was the mid of 2019, I was only doing the half of the UWorld, looking into my strategy, because I was not just doing the questions quickly, rather I was indulging in those questions very deeply. I was not a very topper in my graduation year just because of my same habit. I never ever studied for marks. Rather, I used to study for my knowledge and for the ultimate last goal to become a good professional. Even I used to pray to God in my prayers that first make me a good human being, then after that make me a good professional. So I never ever prayed, oh God, give me a top position in the class. So this was not my focus. I can understand the people the students who take good marks, they are recognized everywhere. But I wanted to recognize myself in front of my patients. So in my area, recognized that medicine is a field that requires a lot of passion and intelligence into the study and defects and applying those concepts broadly onto the patients, as well as listening to the patient's psychological side. That is also important, because if we are treating the patient medically and ignoring their psychological points, then it is very hard to treat those patients completely. So after doing my so I was talking about my USMLE step 1 profession. So it was mid of 2019, and I then renewed my UWorld once again for 6 months. I again grasped the attention of one of the chemologists who was a senior. Maybe he was guiding me according to his own point of view. So I started doing UWorld again, and it was end of 2019. I completed one round of UWorld. Now when now my UWorld was again going to expire, then I renewed it for 1 year. With that, I tried to take my exam by the March 2020. There was also COVID running in the end of 2019, the start of 2020. But suddenly the exams got lost, and the exam centers got lost due to COVID. I was unable to take my exam.